Hi team, I'm Beth Engelbrecht, Head of Health. Over the past few weeks and months, you may have heard discussions about the transformation agenda of the department. You may have heard aspects like organisational culture change, you may have heard about leadership development, you may have heard about structural realignment. It's important that we provide clarity about these aspects, that we provide clarity how they connect, and also clarity why we are doing these changes in the department. As far as organisational culture is concerned, we would like to establish a culture of warmth where people feel welcome in our services and in our offices, but it must also be crisp, where people have clarity about what is going on, where people have opportunities to talk and raise their issues. We're also used to a very much control and environment of control and compliance, and we would like to change that to a culture of trust, of boundaries, of support, of discipline, and of taking ownership. As far as leadership development is concerned, we believe that that is the one leverage that will build the resilience of this department. Leadership for people in their own individual manner, the competencies related to that, competencies of teams and also of our system to support leadership. You may have heard also about Leadership Behaviours Charter. You may have heard about our strategy to improve leadership in the department. You may have heard about restructuring, organisational realignment, and it's important that we would like to improve the management efficiencies in this department. So the question is, how do all of these things connect? If we want to do a realignment of our structures, that must be done within our commitment to good governance, internal good governance. Whilst we have achieved an unqualified audit for the past 12 years, and every one of you have contributed to that, one other aspect of internal governance is also looking at how do we take decisions, what are our processes, what are our systems, what are the structures that lead to those decisions, and can we do that more efficiently, can we do that more effectively? For us to be able to take a step back and look at these aspects, we have to do that in a culture where people feel nurtured and supported. So it's very clear that organisational culture change directly link to our commitment to relook at the way that we take decisions. But to be able to give effect to all of these, we have to look at leadership development. We have to make sure that people have the leadership capabilities to take forward and to implement what is needed. So you might ask, why do we have to change? Frankly, we don't have a choice. Our environment around us is changing, and to stagnate, not to change, is not a choice. You know, when Wade van Niekerk drew the outside lane of the 400 finals in the Olympics, history was against him. Not in 90 years did any person in the 400 finals who had the outside lane win an Olympic medal. He took that as an opportunity, he took that as a challenge, he showed character, he took the race on, and in the end he showed us what can be done. He ended so strong to win the gold medal, to have a new world record. Colleagues, we are in the outside lane. Our challenges against us are the fact that we have to continue to improve our services. We have to improve the engagement of our staff. Staff need to feel supported. We also have to focus on improving health outcomes. All of these have to happen in an environment where our budget continue to reduce. It has been done so for the past few years, and it will continue to do so going forward. We also know that patient numbers are increasing, that burden of disease is increasing. So these are all the challenges in our outside lane. We have to show fitness, we have to show resilience, we have to show character, to take charge of this reality and to show leadership and to take charge of our own future. It is in our hands. So all these challenges to our system requires us to change, and that has led to us to put together a range of aspects that will support such a transformation process. We have looked at good internal governance, which also includes looking at how we take decisions, looking at our processes, looking at the systems, looking at the structures. How can we be better? How can we take better decisions? How can we support our frontline staff more? How can every person in this department feel relevant? But part of that is then also to look at how do we change the organizational culture? How do we move away from control and compliance and fear, and rather to an environment of warmth and crispness, and support and trust? But then also together with that is how do we develop leadership across every person in this department to provide opportunities to be as best as you can, to provide clarity about what are the competencies that will define good leadership in our department. These aspects as a whole then drives our transformation agenda. The transformation agenda in the department must still be seen as focusing on the big purpose of our department in terms of improving health outcomes, ensuring that staff and patients have a good experience. Service priorities in this department remain the main focus of how we design our priorities. We have to look at the burden of disease aspects. We have to look at service pressures, at maternal child health issues. We have to look at chronic conditions. We have to look at the injuries and the violence in our services. And we have to look at our infectious diseases. The way that you want to look at those is to improve the population-based understanding of how we design our services, that we look at the patient flow in and across the services, that ultimately the one platform that we have to invest a lot is in primary health care. Make sure that that system can be as effective as it can be. Look more at how we integrate our services, how we can provide a more comprehensive approach to our patients. And also, how can the critical support services be much more aligned to the needs of our line managers? So the various aspects of our transformation agenda will run in parallel. The organizational culture change processes happen organically in the department. Furthermore, the leadership development, we've already identified a strategy to roll that out further. We've identified areas we would like to prioritize that, and that is also unfolding. As far as the organizational restructuring and realignment is concerned, we have at first, as a top executive, decided whether we are in agreement with the problem statement. We've identified the vision and the principles that will underpin the process going forward. That framework has been made available to every TexCo member, and the task of that member is to engage staff in their teams to take them through the framework, to ensure that questions are asked and there are processes to understand that. In the department, we also established a steering committee. I personally chair that committee because this is such an important and a sensitive matter. At the steering committee, we focus on how the organizational design process will unfold. We've got the support of the Department of the Premier in all of this to give us advice. We also have a focus on change management and communication. So the way we will take it forward is through personal engagements, largely through the department. Top executive managers will have staff engagements, talk them through, listen to the inputs coming through. We will support this with internal communication, with news flashes that will support as we go along. What information become available, we will make that available. It is important that you make yourself available for these sessions, that you do read these news flashes. You have to be on top of all these developments because your leadership is also important for your teams. You have to take this process forward, and it's critical that we then support you with the necessary information. The main philosophy of this process unfolding is that of co-creation. Your inputs is critical. You have the opportunity now to show and tell us how can we do things better, how can we take decisions better. We want you to participate. Your inputs will influence and inform the process. The importance of making sure that you have the information available and that you feel supported is that we don't want people to feel left out. We want people to have the opportunity to raise uncertainties. We need to have management coherence to retain the resilience of our health system. And your leadership in this is critical. So I do realize that everybody in this department, at whichever level you are working in a challenging environment. And I really would like to thank you for the work that you do, the way that you do it. But I've got full faith and confidence that although we find ourselves in the outside lane, that we will build our character, that we will show that we can take charge of this major challenge, but also opportunity in this department. But I rely on each and every one to play their part. I commit that we will form a philosophy of co-creation, that we will take your inputs into consideration. There will be support for staff. We have extended our ICAS capability to be able to provide that support. Each one of you are critical for us to take us through this process. Thank you very much.